causes an inflammation or infection of the clear membrane or conjunctiva that board your eyelid and cover the white area of your eyeballs. Conjunctivitis, often known as pink eye, are different to sore eyes. Conjunctivitis can cause itchiness, irritation, or burning of your eyes, as well as the feeling your contact lenses are hard to wear and don't stay in the place. The causes includes viruses, bacteria, allergies, chemical splashes in your eye, and foreign object in your eye. The symptoms of bacterial conjunctivitis often start to show up to 24 to 72 hours after contact, while those viral conjunctivitis typically take 5 to 12 days manifested. How to treat this disease? Your doctor may prescribe an antibiotic. Ciprofloxacin, this antibiotic comes as a topical ointment or solution. It can be used once every 2 hours or less, often until the infection starts to clear. Tobramycin, typically dozen recommendation for tobramycin instruction to use the eye drop every 4 hours for 5 to 7 days. Erythromycin is a prescription antibiotic ointment that's applied to your eyelid in the thin strip. It may cause some vision blurring for the first few minutes after it's applied. The respiratory infection pertussis, usually known as whooping cough. This is brought by bacteria Bordetella pertussis. Globally, there's around 151,000 pertussis cases in 2018. The major way of pertussis transmits from one person to another is by coughing or sneezing droplets. Infants are particularly vulnerable to this disease, which is major cause of illness and mortality the age range. Generally speaking, 7 to 10 days after infection, the first symptoms shows up. They include low-grade temperature, runny nose, and cough, but typically progressively progress to hacking cough before whooping. Most pertussis cases are contagious up to the 3 weeks after the cough start, and many children who have an infection experience coughing fits that lasts between 4 and 8 weeks. How to treat this disease? Macrolide erythromycin, clactromycin, and azithromycin are preferred for the treatment of pertussis in persons 1 month of age and older. For persons 2 months of age and older, an alternative to macrolide is trimetrorium sulfametazole.
Common cold. Main symptoms of common cold are sore throat, runny nose, sneezing, and cough. How do colds spread? In general, a person contacts the illness and spread it to others from a few days before symptoms appear until all of them have subsided. This indicates that from roughly 2 weeks, most people will be contagious. Families and children at school or in daycare center are among the groups where colds can spread most quickly. What to do? There are no cure for a cold, but you can look after yourself at home by resting, drinking plenty of fluids, and eating healthy foods. Taking over-the-counter painkiller such as paracetamol or ibuprofen to reduce any fever or discomfort. And trying remedies such as gargling, salt water, and sucking on menthol sweets. Hand, foot, and mouth disease. Hand, foot, and mouth disease is caused by viruses. If a person infected with one of these viruses is contagious, which means that they can pass the virus to other people. People with hand, foot, and mouth disease are usually most contagious during the first week that they are sick. People can sometimes spread the virus to others for days or weeks after symptoms go away or they have no symptoms at all. Symptoms and diagnosis of hand, foot, and mouth disease is common in infants and children younger than 5 years old. Most children have mild symptoms for 7 to 10 days. Symptoms include fever and flu-like symptoms. Children often get a fever and other flu-like symptoms to 3 to 5 days after they catch the virus. Mouth sores. Your children can get painful mouth sores. These sores usually start as small red spots, often on the tongue and inside of the mouth, that blister and can become more painful. Skin rash. Your child can get skin rash on the palms of the hands and soles of the feet. It can also show up on the buttocks, legs. Usually is not itchy and look like flat or slightly raised red spots, sometimes with blisters that have an area of redness at their base. Fluid in the blister and the resulting scab that forms as blister heals can contain the virus that causes hand, foot, and mouth disease. Prevention. You can help prevent catching or spreading hand, foot, and mouth disease by following simple steps. Wash your hands often with soap and water for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer. Clean and disinfect prickly, rough surface, and shared items including toys and doorknobs. You can get infected with foot and mouth disease if you have the virus on your hands and then touch your eyes, nose, or mouth. To lessen your chance of getting sick, don't touch your eyes, nose, and mouth with unwashed hands.
Influenza is also known as flu. It is an infection of the nose, throat, and lungs, which are part of the respiratory system. Influenza is commonly called the flu, but it is not the same as stomach flu viruses that can cause diarrhea and vomiting. It is common respiratory illness you get from influenza virus. The name influenza is originated in 15th century Italy from an epidemic attributed of influence of the stars. The first documented pandemic that clearly fits the description of influenza was in 1580. There are causes of influenza. The influenza virus causes flu. There are 3 types of influenza. The most common types of influenza that infect people are influenza A, influenza B, and influenza C. There are symptoms of influenza. At first, the flu may be seen like a common cold with runny nose, sneezing, and sore throat. Colds usually develop slowly, but remember that the flu tends to come on suddenly. While a cold can be miserable, you may feel much worse when you have the flu. Common types of flu include fever, chills and sweats, headache, shortness of breath, tiredness and weakness, runny or stuffy nose, sore throat, and vomiting and diarrhea. However, this is very common in the children. You can also witness it in the adults, but maybe it will just happen in once in 3 months and above. There are symptoms of influenza. In your central part, you will get headache. In your systematic, you will get fever. Yes, it can be a low fever, but usually it is high fever. In your muscular part, you will get tardiness. In your joints, aches. The nasopharynx, you will have a runny nose or sore throat. In your respiratory part, you will get coughing, and in your gastric, you will get vomiting. When it comes to treatment, I will give you some medications to treat the flu or the influenza. And these are the
Oseltamivir phosphate or Tamiflu. You will take oseltamivir by mouth as a pill or a liquid. You usually take it for several days. Zanamivir or Alenza. You need to breathe in the zanamivir through your mouth with an inhaler. You usually have to take it in several days. Zanamivir isn't recommended for people with breathing issues like asthma or COPD. Peramivir or Rapivap, your provider or the doctor gives you peramivir directly into your veins. You usually only need 1 dose of peramivir.
hepatitis means inflammation of the liver. There are 5 vital classifications of hepatitis, and these are the hepatitis A, hepatitis B, hepatitis C, hepatitis B, and hepatitis E. Hepatitis A is a type of hepatitis, is an acute or short-term disease. The hepatitis B, it is an infection, can be acute or chronic. The hepatitis C, it spread through contact with blood from an infected person. The hepatitis D, it is also known as delta hepatitis, is a liver infection caused by the hepatitis D virus or HDV. The last, hepatitis E, found in the stool of an infected person. Symptoms of hepatitis. If you are living with a chronic form of hepatitis, like hepatitis B and C, you may not show symptoms until the damage affects liver function. By contrast, people with acute hepatitis may present with symptoms shortly after contracting a hepatitis virus. These are the common symptoms of hepatitis includes the fatigue, flu-like symptoms, dark urine, abdominal pain, loss of appetite, unexplained weight loss, yellow skin and eyes, which may be sign of jaundice. There are treatment for hepatitis based upon which type of hepatitis you have and whether or not it is acute or chronic. Acute viral hepatitis often goes away on its own. To sense better, you might also just want to restart and get ample of fluids, but in some cases, it might also be more serious. You may need to cure in the hospital. There are other ways to deal with the unique, persistent kinds of hepatitis. Possible other remedies may also consist of surgery and different clinical procedures. People who have alcoholic hepatitis leads to liver failure or liver cancer. You may additionally need a liver transplant. As long as possible, we need to be careful in the things we eat or we do. We should take care of ourselves to avoid this kind of sickness.
Lice are very small insects. They eat human blood and reside on people's heads. The size of an adult mouse is comparable to a sesame seed. Even more little eggs, known as nits, are approximately the size of a termite. The neckline and the area behind the ears are the best places to look for lice and nits. The spread of head lice is quite rapid. People are put at risk through close touch or exchanging items like hats or hairbrushes. Head lice are a common problem for aged kids 3 to 11 and their families. Having head lice has nothing to do with personal cleanliness. Diseases are not spread by head lice. Tickling in the hair, frequent itching, sores from scratchings, irritation, and trouble falling asleep are symptoms. In the evenings, head lice are most active. People with an active infestation of head lice should get treatment. One should check on all family members and other close associates. It is best to treat everyone who is currently under an infestation at the same time. A lice crawly cannot fly or jump, and it's difficult to prevent the spread of head lice among children in childcare facilities and schools because there is so much close contact. However, to help prevent head lice from spreading, if your friend has lice, don't give the lice any chance to spread to you. Avoid putting your heads together or sharing stuff that could contain lice, such as hats or combs. Never share a comb, brush, carrots, or other hair accessories. Use your own and don't lend them to anyone else. Head lice may also spread when items of clothing are stored together. For example, hats or scarves hung on the same hook or stored in the same locker could serve as vehicles for spreading lice. Household pets such as dogs and cats don't play a role in spreading the lice. Tuberculosis is a disease caused by germs that are spread from person to person through the air. In TB disease, the body no longer keeps the TB bacteria under control, and your child becomes unwell. In most cases, TB affects the lungs, but it can also affect the lymph glands, brain, kidneys, or spine. TB bacteria is spread through the air when an infected person coughs, sneezes, speaks, sings, or laughs. A child usually does not become infected unless he or she has repeated contact with the bacteria. TB is not likely to be spread through personal items such as clothing, bedding, cups, eating utensils, a toilet, or other items that a person with TB has touched. Good airflow is the most important way to prevent the spread of TB. TB can grow and cause an active disease in a child with an weak immune system. This can include children who have HIV and diabetes. Very young children are more likely than older children to have TB spread through their bloodstream and cause complications, such as meningitis. A child is more at risk for TB if he or she lives with someone who has TB, is homeless, and has a weak immune system. Symptoms can appear a bit differently in each child, and they depend on the child's age. The symptoms of TB can be like other health conditions. Make sure your child sees his or her healthcare provider for a diagnosis. TB can be successfully treated by taking a full course of antibiotics. A child with TB disease may need to take antibiotics for 6 months